Governor, Lieutenant Governor, good afternoon, everyone. As the Governor indicated, this week vaccinations began at our long-term care facilities. And yesterday, a good day, vaccinations began at the two soldiers' homes in Chelsea and Holyoke for residents and staff. So far, the self-reported information includes 150 residents at Chelsea, 118 residents at Holyoke, and more than 200 staff at the two homes that combined. In fact, CVS had to return to Chelsea this morning to complete staff vaccinations. CVS and Walgreens, CVS returns to the homes on January 19th to administer the second round of doses for individuals who were vaccinated yesterday, and to administer first doses for those who newly consent. Dominic Patella, a 94-year-old U.S. Army Corps veteran, was the first resident vaccinated at the Soldiers' Home in Chelsea. And Robert Acoyne, a 70-year-old United States Air Force veteran, was the first resident vaccinated at the Soldiers' Home in Holyoke. Long-term care vaccination, as you've heard, will continue for the next few weeks, and as the Governor has indicated, next week we will have information on the first responder vaccinations, and are meeting tomorrow with the first responders. EOPS and I are meeting with the first responders to discuss the draft plans and obviously make modifications in response to feedback. As the Governor said last Thursday, the Department of Public Health published the first of a new weekly vaccine report, and we would urge all individuals to use that report on Thursdays for the source of truth around vaccines. The report updates the public on vaccine distribution and progress. It's posted by 5 p.m. on Thursdays and will include information on vaccine supply distribution. The key metrics, which is, if you've looked at it, includes the number of doses of vaccine shipped and administered, the number of people vaccinated, vaccine distribution numbers by county, age and race, ethnicity breakdowns of those receiving vaccines, and vaccines administered by different types of providers. The amount and type of data included on the dashboard is going to evolve over time as vaccinations continue to roll out and additional vaccine products are approved for distribution and administration. The report builds on our state's ongoing efforts to publicly report out data and will help track our vaccination efforts for COVID-19. As you know, the vaccine dashboard can be found at mass.gov/COVID vaccine. And please remember, as you heard the Governor said, there is a lag in the official data from a time of administration to reporting into the MIIS system. As a reminder, we will be converting the daily dashboard into an interactive dashboard starting soon after the 1st of January. It's very exciting, and you'll be able to actually, when you go on to so it will no longer be like a PowerPoint. So when you go on to the dashboard, you actually will be able to change the time period, look at a week, go back and further, so you can use the data. All the source data is on it, and that will be live on January 4th. And also, the COVID-19 dashboard report will not be published on New Year's Day, which is Friday, January 1st, and reports will be published on January 2nd, will include the 2 days of COVID data. Finally, I want to talk a little bit about sites of care. As we prepare and have been preparing for this second surge, and as we see the impact on hospitals, hospitals throughout Massachusetts are experiencing limited bed capacity. They're feeling the strain to care for all of the individuals who are coming to the hospital through emergency departments. It includes patients who have both COVID-19 and others who do not. In just over a month, hospitalizations due to COVID-19 have grown from 986 on 11/26, on November 26th, to just over 2,250 on the 28th of December, which is a 129% increase in hospitalizations. During the same period, we've seen 106% growth in ICUs. Throughout January, the time when we anticipate the most severe constraints on staffing and capacity, we continue to work with hospitals to ensure that any individual who arrives at any hospital throughout the state gets the appropriate care that they need. This may include patients being transferred to other hospitals that may have the available bed and staffing capacity to appropriately meet the individual's need, including our field hospitals. So if you go to an emergency department and your healthcare provider determines you need to be hospitalized, one of 3 options may occur. 1, you will be cared for at the hospital for the duration of your acute inpatient stay. Second, you might be stabilized and triaged at that hospital initially, and then transferred to another acute care hospital, and including our specialized, fully staffed COVID field hospitals in either Lowell or Worcester to continue to receive your inpatient care. Or if not a COVID-related illness, you may be transferred to another hospital in the same region. As you know, last spring we used alternative care sites or field hospitals to support our hospitals to care for the large number of COVID-19 patients. Recently, we've brought 2 field hospitals back online, one in Worcester and one that opens in Lowell next week on the 4th. These sites, these field hospitals, provide state-of-the-art hospital-level care that's been an example of best practice across the country. Patients at field hospitals receive care by a team of doctors and nurses expert in COVID-19 care, and the same care as you would receive at any of our great hospitals in the Commonwealth. Taking this approach means everyone gets prioritized to receive the safe and high-quality treatment and care that they deserve. Please discuss with your healthcare providers where you can receive the best care possible and support them as they work tirelessly to deliver the care to all patients across the Commonwealth. And if I do not see you before the holiday, I'm sure all of us will say good riddance to 2020. Please be safe, practice bubble fidelity, celebrate small, and see you in 2021.